I have to say I was really inspired by both of the talks, and I'm coming from an adjacent field, but something that I don't really think a lot about. I focus on brain behavior markers of depression and suicide in adolescents, and we're often focusing on the problem and trying to build up inherent strengths in people or figure out what associated resources could be brought to bear to help families and teens overcome some of the many obstacles in their lives. And it was interesting to think about some of the work that both of you are doing, and in particular with some of the work that Jenny presented, because we're looking, ostensibly at college students, which, they're still obviously developing and they're progressed, but I'm thinking of it more from a developmental perspective in this idea of, the practice of instilling awe or taking the time to develop this is not the right verbiage, so forgive me, like kind of the awe muscles, so to speak, to kind of build up that tool. I would imagine really could start potentially earlier on. Is awe a treatment, or is it an everyday practice that helps facilitate other kind of interventions broadly?
Everyday life. I think it can be both, right? So I do think building it in as an everyday practice in the way that, similar to meditation, that you can build it in as an everyday practice is incredibly useful. For me, that's going out on nature walks. People can pick whatever works for them. And then why can't it also be an intervention? If you can really create these big experiences for people, we know we have them out in the world. Even concerts for a lot of people are like that. We know we're going to go and we're going to have this really effervescent, awe-inspiring experience where we're in a group and we're all having this experience together. So I think a combination is best. And I do think we can utilize them depending on what we want to do. Certainly, if you're working with somebody who has depression, an intervention that they might not be motivated to do, but they experience really positively could be really useful. And then it could open the door for other interventions that you layer on top of it. I think Lonnie's right. It's a little earthquake. And the benefit of that is it creates little cracks that you can utilize for promoting healthier cognitive strategies, things like that.